Welcome to NSG 227, Study Session 4, Collection of Urine Specimen. Introduction. Collecting urine specimen is one of the diagnostic measures used to identify pathological conditions. The nurse contributes in the assessment of a client's health status by collecting specimen of body fluids of which urine is inclusive, and this provides a measure of observing responses to therapy. In this study session, you will learn about general principles on nursing responsibilities during collection of specimen, terms associated with collection of urine specimen, assessment of clients, and methods of collecting urine specimen. Learning outcomes. When you have studied this session, you should be able to 1. Define the collection of urine specimen. 2. State the general principles or nursing responsibilities during collection of specimen. 3. State the terms associated with collection of urine specimen. 4. Assessment of client. 5. Methods of collecting urine specimen. Defining urine specimen. An analysis of the constituents of urine, including a description of color, odor, specific gravity, deposits, amount, reaction with litmus, and abnormality. Terms associated with urine specimen. 1. Clean catch, midstream. A voided specimen caught in a sterile container after cleansing of the mucus and voiding a small amount prior to catching the specimen. It is used for urine culture. 2. Catheterized specimen. Insertion of a tube directly into the bladder to obtain a sterile urine specimen. 3. Random specimen. Collection of urine under clean condition for laboratory study, e.g., routine urinalysis during admission. 4. Timed specimen. Urine collected for a specified period of time, usually 12 or 24 hours. 4.2. Nursing responsibilities during collection of specimen. These are the general principles. 1. Provide client comfort, privacy, and safety. This is because clients may feel embarrassed and may not totally participate during the procedure. The nurse should be non-judgmental and should be sensitive to the client's sociocultural beliefs. 2. Explain the purpose of the specimen collection and the procedure for obtaining the specimen. Clients may experience anxiety about the procedure, and proper instruction promotes independence and reduces embarrassment. 3. Use the correct procedure for obtaining a specimen, or ensure client follows the correct procedure if he has to do it by himself. Maintaining asepsis is essential to prevent contamination that can cause inaccurate results. 4. Relevant information on the laboratory requisition slips should be well noted, e.g., medications may affect the results of the investigation. 5. Specimens should be sent promptly to the laboratory for accurate results. 6. Abnormal findings observed in the specimen should be reported to the healthcare provider in a timely manner consistent with the severity of the abnormal results. Assessment of clients. 1. Assess client's ability to understand instructions and to obtain specimens properly. 2. Identify if signs and symptoms of urinary tract infection are present, e.g., frequency, urgency, dysuria, hematuria, flank pain, cloudy urine with sediments. Nursing diagnosis: 1. Altered urinary elimination pattern. 2. Fluid volume, excess related to compromised regulatory mechanism. 3. High risk for injury related to internal biochemical factors resulting in electrolyte. 4. Imbalance. 5. Pain, flank related to physical injury agent of calculi resulting in. 6. Irritation or inflammation, obstruction of urine flow. 7. Risk for fluid volume deficit. Methods of collecting urine. A. Collecting a random specimen of urine. Random specimen is an adequate specimen for routine investigations. Some clients can collect this specimen by themselves, except very ill patients who may need to use a bedpan or urinal. It is usually done on the first voided specimen in the morning because it tends to have a higher, more uniform concentration and more acidic pH than specimens later in the day. Urine collecting bowls can also be placed in toilet seats. Specific instructions are: the specimen must be free of fecal contamination. Container should be covered tightly to prevent spillage. Toilet tissue should not be discarded in the bedpan when it is used, as this makes laboratory analysis more difficult. B. Collecting midstream specimen of urine. Objective: clients will understand the need for the urine specimen. Clients will provide a clean urine specimen in a manner described by the nurse. A small tray containing sterile specimen bottle. 1 pair of gloves in a kidney dish. Bottom shelf. 1. Destructor bowl. 2. Kidney receiver. 3. Bedpan. 4. Destructor bowl. Implementing nursing procedure. Female patients. 1. Inform client about procedure. Rationale: this helps obtain patient's cooperation. 2. Provide privacy by drawing the curtains or screens. Rationale: this reduces anxiety, fear, or embarrassment and provides respect for the patients. 3. Remove the lids of the destructor bowls. 4. Untuck the top sheet and arrange in such a way to lessen exposure. 5. Sit patients on a bedpan with knees flexed and legs apart. Rationale: correct positioning aids the procedure and provides comfort to the patients. 6. Remove lids of bowl on top shelf. 7. Using sponge holding forceps, swap vulva from above downwards. Male patients. 1. Prepare trolley as explained. 2. Explain procedure to patients in order to gain cooperation. 3. Provide privacy as this shows respect to the patients. 4. Cleanse end of penis with cleansing swab on sponge holding forceps. 5. Clean with a circular motion around the meatus and the surrounding area. 6. After passing a small amount of urine, the patient should void directly onto a sterile container. The microorganisms which accumulate at the urinary meatus have been flushed out with the original stream of urine and are not collected in the specimen. 7. Cork the sterile bottle. Patients teaching. Teach importance of adequate hydration for proper kidney function. Caution collection of urine before defecation. Remind female patients the importance of cleaning the urinary meatus from front to back. Observation. Note the color and appearance of urine. Note any difficulty in voiding. Documentation. Record name of patients, time of collection of specimen, type of specimen, date of collection. C. Collecting 24-hour specimen of urine. This is a timed specimen collected for a 24-hour period. Objectives: to maintain collection of urine for 24 hours, to assess the ability of the kidney to concentrate and dilute urine, to determine levels of constituents such as creatinine, certain hormones, albumin, etc. Requirements: 1. Urine specimen container. 2. Preservative, HCl, thymol. 3. Requisition slip. 4. Label for specimen. 5. Sign that urine collection is in progress. 6. Container with ice if needed. Patient's preparation. Explain procedures to patients and stress the importance of saving all urine for 24 hours. Place sign in client's bathroom stating that 24-hour urine specimen is in progress with date and time. Implementing nursing intervention. 1. Specimen should be collected for the exact amount of time specified. 2. A bottle from the laboratory with an appropriate preservation should be labeled and placed in a convenient place where it will not be spilled. Special considerations. Infants. 1. Clean the perineal area and the urethra opening as in adults. 2. Apply a specimen bag that has an adhesive that attaches to the skin. 3. Gently remove the bag from the skin after voiding a desired amount. Children. Explain to the child in non-medical terms appropriate for age and ask child to void using a clean receptacle such as collecting jug, bedpan. Allow parent to assist child. He may feel more comfortable with a parent present. Straight catheterization may be necessary if sterile specimen is required. General characteristics and measurements. 1. Color. Pale yellow to dark amber is mainly determined by the concentration of the pigments urochrome, urobilin, and ureathrin. 2. Clarity. Clear to cloudy due to leukocytes, bacteria, epithelials, or precipitation of phosphates. 3. Specific gravity, SPGR, may range between 1.001 and 1.025. 4. pH 4.5 to 8, average pH around 6. 5. Volume 1000 to 2500 cc, 24 hours, adult. Chemical determinations: glucose, ketones, blood, protein. Study session summary. In this study session, you examine the general principles or nursing responsibilities during collection of specimen, terms associated with collection of urine specimen, assessment of clients, and methods of collecting urine specimen. End of study session 4. Thanks for listening.